Whoa, I think we did it. Apologize, everybody. It'd be weird if we didn't have technical difficulties here at the anatomy lab. So just want to get everything situated. And everybody can hear me, right? I got the sound going okay. So I want to just introduce kind of what's going on, what we're doing. Thanks for everybody's support for coming out. It's been a little while since we've done a live stream, and we are ready to go again. So Justin and I have been doing a lot of different things. Those of you who follow us on TikTok, you see Justin's face a lot. I do a lot more of our Instagram stuff. Jeremy, behind the scenes, he's the other owner of the Anatomy Lab. He does all the a lot of other stuff that you guys don't get to see behind the scenes. But today I wanted to go. I'm a little loud, I think. Today I want to talk about some stomach anatomy. I got a stomach out over here on the side to let you guys take a look at, and also do our typical Q&A live sessions, and also give you guys some ideas of what's coming on. Like I said, Justin and I have been pretty busy doing some other things, but now we're going to start dropping weekly YouTube videos, and that's going to be nice. Our next series of YouTube videos are going to be reproductive videos, so we're pretty excited about that. So we're going to do female reproduction over the next 4 weeks, I think, because it's not necessarily the most easy concept to go over, so we have to break it down throughout the 28-day menstrual cycle. I know it's going to be a little funny having a dude go over that with us. So let me kind of get everybody going over some of the comments here, and let me just start with, let me show you some cool stuff with stomach. I'm going to glove up, and then we're going to go over to this other camera and take a look. So give me 1 second to do that. Here we go. So, pretty epic, you know, because you can see plastic and stuff, but if I remove the plastic, we get to take a look at the digestive tract. So it's kind of cool to see this, but I'm going to try to orient this. This will be something we'll do in just a second, and then we'll go over some of your guys' questions here. So the gut tube is truly an anatomical term. Well, it's more of like an embryological term, because it is just one long tube. Now here, you guys, is the very bottom of the esophagus. That is essentially where the food comes down to the throat, and then when it balloons out right there, you can actually see the stomach. And then we have the small intestines, so lots of fun here. Now the gut tube can be up to 20 feet long. You guys can see I'm just moving through the small bowel here. Hopefully none of you guys just ate lunch. But what's crazy about this is the length of the small intestine is all about digestion. Well, I'm sorry, all about absorption. And that's why it's so long. We need lots of length to absorb all the nutrients we ate. Now, when it balloons out again, this is where we refer to as the large intestine. So, and this kind of pictures up and goes around here. So, one of the other cool things I want to show is this is the other part of a stomach. So this is from a different cadaver, and this is essentially how this one matches up to this stomach there. And so you can see we've cut here where the stomach was going to swoop into and narrow down to go into the small bowel. One of our favorite things to show, and one of our coolest TikTok videos that we did, is we actually had, let me just, Justin fold out the stomach there, which is pretty crazy to see all those folds there. So those are called gastric rugae. Rugae just means folds. Gastric just refers to stomach. So super cool to see that that's the inside lining of your stomach. And what happens is for those gastric rugae is those will actually stretch after you eat a big meal like Thanksgiving dinner or whatever binge that we go on for food. but it's pretty crazy. That allows the stomach to stretch, to hold up to almost 6 liters of food, which is pretty crazy to think about. And we'll go into some other stuff with the small intestine. I just wanted to give you guys a quick little tour of the stomach and the small bowel. And since we have limited time today, I want to give you guys plenty of time to ask your questions and go from there. So I'm going to go up from the top of the questions here. And so this is one of my favorite features here. We've got somebody who feels butterflies in their stomach. That's kind of ironic, right? So I'm just going to go through your guys' comments. If there's questions in there, we'll address those as we go. And we got to do this. This has got to be one of my favorites, right? Warren loves this channel. Thanks, Warren. We're super excited about that. And then, is this a comment? We're just saying hello to everybody. And I think we're coming to our first question here. Oh, she's going to bed. I have a question I'd like answered. Where are you if you're going to bed this early? It's only 3 o'clock where I am, but let's keep going here. And what's happening here, you guys, is this font is so small that I'm going to have to pull my old man glasses out here. So, let's do this question. So here is a question that says, it's Gen B. Can you please tell me what happens to the bypass portion of the stomach after gastric bypass surgery? Does it flail around? Is it necessary to keep? How does food make it to the bowel? You know, I didn't get a ton of experience when I was doing general surgery in school. It's all like appendectomies, gallbladder removals, and things of that nature. It depends on the surgery. I do know there are different types of gastric bypass surgeries, some that are reversible, some that are not. I know the old school one is they took the body of the stomach together and then reattached the proximal and distal end of the stomach, so the beginning and the end of the stomach, and that just made the stomach actually smaller. I think the sleeve is, and I probably shouldn't answer this right now. I'm actually going to pause there to get more information on the gastric sleeve. I'll talk to some of my general surgery buddies that actually perform that surgery. But so I'm going to hold on that. But it doesn't just flail around. I can answer that at least for now. It's depending on the procedure. Some are reversible, some are not reversible. But Gen B, I owe you a explanation that we will address as soon as I talk to some of my general surgery buddies, but I don't want to give you anything inaccurate there. So let's keep going here. We got a high. When does it start? Sorry guys, we had an internet issue there. We got a hello, we got a yes. Gastric rugi. So, Haywood, did you have any more specific questions regarding the gastric rugi? Or I'm assuming you probably saw us go over the gastric rugi there just a second ago. So, let's keep going. If you have questions, put it on for us. Hello. Thank you for your content. So, this is from, if I just destroy the names, you guys, I'm really sorry. But Discoho77, thank you for your content. Thank you for watching. Let's continue on. Oh, 236 in India from one of our viewers. That's pretty crazy. So, thanks for watching. Sorry, guys, I'm just trying to go through and get some questions here. There's a lot coming through. This is a fun one. What if we get a punch to the stomach? What happens? Well, in our Instagram video, usually you don't get punched in the stomach if you watch. Now, the stomach's actually located right up here in the left upper quadrant, and most people don't get punched directly in there. They mostly get punched in the central abdomen, which is mostly the guts. Most of the time, most of us get the wind knocked out of us and we move on, and the actual stomach organ itself doesn't really get affected. The intestines, not so much either. I mean, most of us can't punch hard enough to really cause a major problem with the intestines. So, oh, this is a good one. What is constipation and why does it happen? Kristen, Disney girl. First of all, I miss Disneyland. I think Disney World is open because Florida has a little bit different rules around COVID-19. But regardless, back away from Disneyland, let's talk about constipation. Constipation can be multiple things. Constipation can be influenced with diet. Constipation can be influenced with, so diet specifically like fiber. If you have a low fiber diet, that can cause a buildup and things don't pass through the colon as well. Dehydration doesn't help much, so you want to drink plenty of water. That can kind of help flush and keep things a little bit softer. Holding your stool, literally actually holding it, will cause the stool to get a little bit harder, and then when you're ready to pass it, makes it more difficult to pass out the colon. I had a student that told me that her son did not like to go number 2. He didn't like to take a poop or didn't like bowel movements. And she would say that finally when he was supposed to go, it was like super duper hard, like really hard for him to go. And that's because the last part of in the digestive tract is the colon. And the colon's job is, one, yes, to store fecal matter for when you're ready to put it in the toilet, hopefully the toilet, but it also is a drying organ, meaning it absorbs the last part of water. So the longer stool is in your colon, the more water gets sucked out, and therefore the stool gets harder and harder and harder and gets more packed and hard to pass through the rectum, which we have a limited size that we have to go through with the rectum. So when I've had patients who have had that, sometimes we have to give them a suppository to soften the stool up. Sometimes they can do it with things like Dulcolax or, Metamucil or Miralax to help kind of soften things up and push things through. It depends. Each stool softener kind of has different properties, so it depends on which stool softener. One thing that also has one of my last patients, actually, she came in, and sometimes we do abdominal x-rays. The abdominal x-ray has a little bit of there's a bit of debate on the utility of an abdominal x-ray. Depends who you talk to. Some people say use it for some things. Some people say it's outdated. It doesn't tell us enough, so why even bother with it? But sometimes it can show you a buildup of fecal matter or feces in the colon. And I had this patient who hadn't gone number 2 for 5 to 6 days, which to me is a long time. And maybe that's too much information on the regularity of my bowel movements. But moving on, the 5 days is a while, and come to find out she was on opioids. So opioids are certain pain medications like Lortabs, Percocets, things like that, and those are known to also cause constipation. And so that was kind of the cause of her constipation. And like I said, there's a few different causes. Hopefully that answered your questions. Maybe I went into a little bit too much detail there, but thanks for the question, Kristen. So, let's see. So I have Athene Nafali, I think, if I pronounce that right. Forgive my ignorance. Where are you folks based? No need to apologize for that. Not a lot of people know exactly where we are, but we are in the leafy little hamlet of Salt Lake City, Utah. Born and raised here, so yeah, it's got typically has 4 seasons, which is kind of cool. It's been 100 degrees the last couple of days, except for yesterday. It dropped down to 70 because I always joke around and say Utah's kind of a little bit bipolar. This isn't really anatomically relevant. Well, I guess we could say bipolar disorder is relevant to anatomy and physiology. But anyway, the weather is, you get fall, spring, summer, and winter. Pretty crazy winters, actually. So yeah, Salt Lake City, Utah. Thanks for the question. We got Louisiana. We got some hellos. Please don't write unnecessary things. Lilith, I would disagree. I feel like maybe I shouldn't put this in here, but it says, we are ugly as F on the inside. I think we're beautiful on the inside. That's just me being cheesy. But I think the intestine, all the organs, like once you get past what we're trained to think of, like all the horror movies and things like that half the time get the anatomy wrong anyway, this stuff is pretty amazing. Like look at our Instagram posts. We just started doing reels. Those are fun. Look at our Instagram reel on the brain. That is like the prettiest structure ever, the cerebellum. Like you'll see some really cool structures in there. Check that out. I don't feel like that's ugly, but everybody's entitled to their own opinion. So I like this one. Discaho77, why am I eating lunch and watching this? So, I'm jaded. I think that I want to tell a story about this. I don't think it's gross anymore, but again, I work and have been in the cadaver lab for 13 years now. And so, the funny thing that I did once, I was up at the university when I was getting my training. This was like 10 years ago. And one of the things I was in charge of when I was in the anatomy lab up at the university is I was to train younger teaching assistants coming through. And I remember I was in the office eating my lunch, and the office was attached to the lab, and these two teaching assistants came in and were like, hey, Jonathan, we want you to come show us some of these structures. We have a couple questions before we have to teach this lab. And I'm like, okay. So I go out there, and I'm looking down into this body cavity, and it was just the abdominal cavity. And they're like, well, we're trying to see what this is. And I'm just in there. I'm like, oh, this is this, pointing. And they're just like not even looking at where my hands are going and paying attention. They're not paying attention to anything that I'm really saying. They just have this look on their face like, and I'm like, what? What's going on? And they point at my hand, and in my hand, I still had my peanut butter and jelly sandwich. So to teach them a lesson, I was like, and took another bite out of it and laughed and went back into the office. So some of us eat while doing this stuff. Okay. Keep going. Wow, we have green beans. Sorry guys, just going through these again. That looks insane, dude. That was from Unicorn Horn 96. I agree, but insane in a good way. Okay. I walked into a poll today. Emily Bell, that's interesting. Were you on social media? Just like, I'm sure you were looking at our TikTok, our Instagram posts, and you were so enthralled that you looked into it. So we can go over concussion protocols in one of our future videos, which I think we will do. And so concussion protocols are pretty awesome. Hopefully you didn't get a concussion or hit your head. Maybe you can give us some more information on that. But I'm hoping you're okay. So this is a good question. Rahul Gut, how old was the body? So the bodies, it just depends. We have multiple bodies in the cadaver lab. This came out of a person that it was a female in her mid-80s, passed away from breast cancer. It's always interesting when we're in the cadaver lab and we get information about the cadavers. They can't give us all their health information. It'd just be impossible for a body donor program to gather a lifetime of health information before they donate to science. So sometimes you have an idea of what their most recent health history is, especially if they died from something. So, for example, that cadaver died of breast cancer. So we did see the tumors in the breast tissue, but a lot of times we'll do dissection and we'll prepare for courses and we'll find things that was not mentioned in either like the death certificate or we didn't know from the health history. So a lot of interesting things, like one of our bodies had a partially ruptured Achilles tendon and had all this scar tissue built up in it. So that was pretty fascinating to see as well. So let's see here. What happens when we burp? So what happens when we burp? I always tell people that we get gases that come from both sides. Some come up, some go the other way. And essentially what we're dealing with is a whole bunch of, in a way, kind of to simplify it, chemical reactions that go through this process of digestion, and sometimes when we break down things, gas is released from those chemical reactions, and it depends where it is. In the stomach, if there's gas in the stomach, then it'll come up because it's so close to the surface here. It'll come up out the esophagus, and you'll belch it up. Carbonated beverages, there's carbonation in it. There's gas kind of inherently in those. Just you can see from like all the bubbles that come up from carbonated beverages. The other end is you're kind of going to the colon, and you've broken down a lot of the food and things of that nature, and it's moving through the colon, and you've got some gas that just kind of this release of gas from chemical reactions that are going through all the enzymes that are released from the pancreas, that are released from breaking down fats and proteins and carbohydrates. So that hopefully that gives you a little bit of an idea there. Sorry, I couldn't read that. What do you think about Romania? Pillar of Grass, I have never been to Romania, except I feel like I always get reminded of Count Dracula or something, but that's Transylvania. So maybe that's not a great one. Here's a question for us. What does it smell like when handling the cadavers? That depends. So it really depends on where you are, what cadaver lab you are. I'm not going to call any labs out. There are some labs that I feel like are still living in the Stone Age and still bathing cadavers in pots of formaldehyde. I have no idea why we're doing that, because that is smelly, messy, everything. We keep our cadavers in bags, and they've been fully embalmed, and we use this stuff called phenoxyethanol, which is a wetting agent. It's 99 parts water, 1 part phenoxyethanol. It doesn't have a strong odor, and so there's a lot of factors that go into the smells in a cadaver. Ours doesn't have a huge smell here because we try to keep it clean. That's a shout out to Jeremy. He's one of our owners here. He's very proud of what he did the other day, you guys. He cleaned the back room, so be all excited about what Jeremy did. But and anyway, so we try to keep the lab really clean, and that helps to diminish the smell. And it really depends on what you use. Some people use ethylene glycol. I think that's got a little bit of a stronger smell. We use phenoxyethanol. The full bodies tend to have the strongest smell, especially when you first get them from a body donor program and the embalming fluid is still precipitating out of like the pores and things of that nature. So when we, like the intestines that we had here that I showed just a few minutes ago, those don't have a strong smell. As we keep spraying the body parts with our phenoxyethanol and they've been removed from the body, the smell gets less and less intense over time. So we have Eloise and Alt. How big can the stomach stretch? So the best analogy I would say is it can compress up to about 6 liters of food, if I'm right. I think it's about 6 liters. Was it 6 liters? Yeah. I'll fact check myself and correct myself if I'm wrong, but I'm pretty sure it's around 6.5 liters ish. That was on our Instagram post. So and so I kind of think like, what is 6 liters? Like we kind of think of like 2-liter beverages, and those can be pretty insane as far as like just the size of like a 2-liter beverage. Did we slow down? Are we losing the internet connection? I'm getting some notifications on that. Can you guys all still? I got a thumbs up on that, so I'm going to go ahead and actually, yeah. Okay, I think we're okay. I get texts from Jeremy and Justin telling me, hey, this is going wrong or that's going wrong, so I apologize, you guys, if I have to look down and get those. Oh, we just have to put this up. Eden, we love you too. Thank you. This is an interesting question, actually, this next one. JavEB, when doing a surgery for weight loss, why can't they remove a portion of the intestines instead of just removing part of the stomach? Now, that kind of goes into just the ability of what the stomach can store, right? So if you saw how much the stomach can stretch and distend, it's a much better fix to decrease the size of that, because the whole point of these surgeries is to decrease the amount of input, food going in. And so if we've got this organ that can hold 6 or 6.5 liters of food, then that's the kind of the target organ. Now, another problem with taking, if you were to take the small bowel out, is the small intestine is the primary source of absorption. And so you can't take the piece, I mean, you can, but we prefer not to take the big absorbing part of the gut tube out, because we still need to get the nutrients that you do put into the stomach into the small bowel so it can actually be absorbed into the bloodstream. Now, the stomach does absorb a few things, but it's mostly, its primary job is to be this muscular blender, because as you eat, the muscle contracts in the stomach and churns and actually kind of mixes everything together, and also has some enzymes in there to start breaking things down. But primarily, we need that small bowel to absorb all that thing. And we're talking about a tube, as you can see, that's not very big. And that just wouldn't be a very good target for weight loss, because, again, you got to target the thing that you can stuff full of food, because you can stuff it full of food and it'll sit in there for hours. I call it my food baby. Like, I overeat all the time with certain things, and I've got all this food just stuck in there just waiting, because the stomach slowly releases its contents into the small intestine as it's ready to break it down further and move things along. So hopefully that gives you an answer to that question as well. This is an interesting question. Baya, how can I support the channel? Oh, being here helps support the channel. Subscribing helps support the channel. Watching our videos helps support the channel. Following us on Instagram, all that stuff, just watching us and giving us suggestions, commenting, those things are very supportive to helping us do what we need to do. And yeah, I mean, we do have merchandise. It's kind of small right now. We have a couple of t-shirts that we're selling, a hoodie. We're going to open that up a little bit more as we continue on this process. And we also have affiliates that can support us. But, if you like artwork, we have Codex Anatomicus. I'll probably grab one of their pictures in a minute that you guys can look at. And those are kind of the best ways to support us. But we're just glad you guys are here asking questions even. So this Lilith, what's inside the folds histologically? Now, it depends what folds you're talking about. Now, if we're talking about the stomach folds, the gastric rugae, the epithelial lining is referred to as simple columnar epithelium. What that means is they're tall epithelial cells that they're actually ciliated as well. So, sorry, that's the respiratory tract, but tall columnar cells. And so that's kind of the histological of that. Now, there's some cells that produce mucus mixed into that help kind of secrete mucus into the stomach. But primarily, it's these simple columnar epithelial cells that just run along those gastric rugae or those gastric folds, mixed with some mucus-producing cells, because it's really important in the stomach with hydrochloric acid. There's this question that I get a lot in classes as far as, like, why does the stomach not eat itself alive? Because hydrochloric acid's pH of 2, pretty nasty stuff that got on your skin. And what happens is, if this is the lining of the stomach, these cells produce a coating of mucus, and then the acid goes on top of that, and that's essentially stops you from kind of eating your stomach alive. Now, if you do anything that produces more acid or reduces the mucus, that can cause issues with, say, like gastritis linked to ulcers. One of the things that reduces mucus is NSAIDs, which are non-steroidal anti-inflammatory drugs, and those, like ibuprofen, Aleve. And if you take them every once in a while, usually you're fine. But people who are on them chronically, that can upset the stomach, because it reduces the amount of mucus that is on the inside lining of the stomach, and then the acid can cause more problems. This is stuff we love hearing about, you guys. I want to be a pathologist when I'm older. Anything. One of mine and Justin's favorite things to do is inspire people to. Maybe I feel weird saying that, like we inspire, but that's kind of our hope, is to give people in enough of an interest in the sciences, especially the biological sciences. We're kind of biased to the biological sciences, especially anatomy and physiology. And hopefully when people see this stuff, they get interested, and it kind of pushes them in a direction that they want to do this stuff. I never would have thought that I would be sitting in my own cadaver lab right now doing a live stream on YouTube. Never in a million years. And it's happened. And not that I'm saying everybody who does this is going to get on to doing their own cadaver lab and things of that nature, but it's definitely a cool thing to follow these things that inspire you, make you interested, and can help people. And so I love the biological sciences and what they can do and what they can help people with. Pathology, when you're saying a pathologist, pathology is just anatomy and physiology gone wrong, is what I tell people a lot of the time. So good luck on that journey. So Adrian, why does heartburn occur? There, we often refer to this as GERD, gastroesophageal reflux disease. I think Justin did a video on this on YouTube. The short answer is that there's a sphincter at the very proximal, or you could say the top portion of the stomach, between the stomach and the esophagus. And a sphincter is just some smooth muscle that contracts and can narrow. And different books call it a different thing. Some books call it the cardiac sphincter. I don't like that because it's a little misleading. It has something to do with the heart, but it's just by the heart. Other books call it the lower esophageal sphincter, which I think is a way better name because it's on the esophagus. And so what can happen is if that esophageal sphincter is a little bit more loosey-goosey or relaxed in somebody, acid can trickle up from the stomach into the esophagus. And that's not the only thing that contributes to it, but is a predisposing factor, you could say. And other things can influence that. If you eat more things that cause acid to be produced, or a higher concentration of acid to be produced in your stomach, you're going to have more likelihood or more risk of flare-ups for heartburn. Now, all of us have had heartburn at one point in our lives, but with people who have chronic heartburn, I'm like, we got to stop eating things that are going to produce acid, especially during flares. So things that, just some example of a couple of things that produce acid or too much acid in the stomach can be caffeine can do it, spicy food can do it, really greasy food can do it, alcohol can influence that. And so I've had bouts of heartburn myself, and it doesn't usually mean I can't ever have any of that good stuff again, because who doesn't want some greasy food every once in a while or some spicy food? But definitely during a flare, you have to help with that. Now, the medications that you use for a heartburn are like Tums. That's like the lowest grade, I guess the weakest medicine, but sometimes people get relief just with that. Others are histamine inhibitors, so like Zantac or Pepsid, and then you've got omeprazole, which are the proton pump inhibitors. Proton pumps inhibitors are things that inhibit the production of acid in the stomach. So that was a good question. Why does our stomach rumble so loud? Unicorn. So I'm just going through these list by list. So we're getting just tons and tons more questions. Wow, this is a long list. But thanks for the questions, you guys. Why does our stomach rumble so loud? Sometimes it's not your stomach. Sometimes it's actually your transverse colon moving feces from one side to the other. I know, right? Like sometimes it's poop making the noise. But yes, sometimes the stomach rumbles, but the rumbling essentially comes from peristalsis, which is a fancy pants way of saying the smooth muscle contractions of your digestive tract. So your stomach contracts on its own, your small bowel, your large bowel, and when those things are moving around, sometimes it's like it can make noise. Now, yeah, when you're hungry, sometimes your stomach's empty and it kind of shifts around and moves, and that'll make some noise. Especially when you put food in, that can also make some noise because you're going to start this process of peristalsis. But it can be anywhere in the gut tube that you can hear bowel sounds. When I put my stethoscope in the clinic and I have somebody with abdominal pain, I'll listen in 4 different points for bowel sounds to make sure that I can hear those, that the bowels are functioning properly. You kind of look for what they call hypoactive bowel sounds, which would be very diminished bowel sounds. You're kind of like, what's going on with that, versus hyperactive bowel sounds. And sometimes you get a little hyperactive if you guys have ever had gastroenteritis or like the stomach bugs with like diarrhea, vomiting. Sometimes they're a little bit more overactive than normal. So Harley Levert, yes, it is. But it would take me a while, so we'll do that for another live stream. Justin did a TikTok video on it. I think he did a TikTok video where he pulled the pancreas out and showed it on TikTok. It's a short little blip, but we are going to do an endocrine series soon. An endocrine series is like the endocrine system, which is a whole bunch of different organs that secrete hormones. The pancreas is one of those because it secretes insulin. And so there's this endocrine or hormone producing part of the pancreas. And definitely during our diabetes video for that portion of that series, we will show the pancreas. And that is in the works. Kabed Zaman. What shape does the stomach take when it's empty? Now, it is. We always say it's kind of like this J-shaped organ, and it maintains that shape. It just becomes like flat or more flabby, and that's essentially the same shape that it has. It's just not going to be as stretched out or robust. So it's mostly maintains the same swooping J shape. It's just it might get more ballooned up. Kind of think of almost like a balloon that you'd blow up with your mouth, like in a J shape. And as you put air in it, it would still kind of have that shape. It would just start to expand, and when the air came out, it would compress into that same shape. Zach says, why do we feel full if the stomach can still stretch more? Well, there's always going to be a limitation to that. There's going to be a limitation to how far this thing can distend. And, you know, I always think about those hot dog eating contests where people just eat a ton. And I'm like, I wonder if some of that's like starting to trickle up the esophagus. Like, talk about heartburn. And there's going to be a limitation. So, and there's what there is in the digestive tract is there's these receptors that respond to stretch. And once those stretch receptors start sensing the amount of stretch in the stomach, that gives a sensation to the brain that says, okay, I'm starting to get stretch and distension, and that's signaling, hey, I'm getting full here. Let's stop pushing things through. Now, we can override that and keep pushing stuff down, which they do in those hot dog eating contests. But distension can cause a lot of discomfort in the digestive tract, not just in the stomach. And not to be immature here, you guys, but the colon really can get uncomfortable with gas and distension. Because if you have a big gas bubble in the colon, it stretches it out. And your colon, like I said, has those stretch receptors that respond to stretch. And when you relieve yourself with the gas, it feels a lot better. Just saying. ZT Vlogs, here's a good question. Can your stomach shrink if you don't eat? And I think the short answer is yes, in a way. I think people overblow this. Like, if you don't eat, your stomach's going to shrink, and then it's going to be, you're not going to eat as much later on. You can just stretch it right back out. And it's not like, what tends to happen is the smooth muscle starts to just has some tone in it. All muscle tissue always has some level of tone. And so, like, even though you guys, like, for example, even though your biceps is relaxed right now, there's some level of tone in that muscle still sent from the nervous system that has it's kind of buzzing on just a little bit. And that's the same in a way with your smooth muscle in your bowel. And if there's no food in there, just kind of imagine that the tone of that just kind of slowly kind of compresses it. Now, it's not going to completely involute on itself completely. Again, there's always limitations to this, but say you went on a fast and you didn't eat for 2 days, that smooth muscle that is in the wall of the stomach would essentially start to compress, or just contract, and it would give this kind of idea that the stomach is shrinking. And so I feel like it's not necessarily like going to change its overall size ultimately. It's just that smooth muscle tone can kind of give it a little bit of that compressed or shrinking, for lack of a better word. But you eat a big meal, give yourself 2 big Thanksgiving dinners, you'll stretch it right back out. So, IBS. Sorry guys, we're just going through some of the questions. So here's one. Can you explain what IBS is, please? So irritable bowel syndrome. We always talk about it in the clinic being a kind of a diagnosis of exclusion, meaning you've ruled out all these other things because there's not a definitive test for irritable bowel syndrome. And so when we have ruled out other causes of a patient's symptoms, and that can be challenging because some people with IBS will have diarrhea, other people will have constipation, and then this discomfort level, and you get all these tests back that are normal. And so the biggest thing that we talk about with this, and I don't deal with it on a long-term case just because I work in urgent care, and so sometimes as people who have bad IBS, I'll send them to a GI specialist to go through that. But a lot of IBS has to be treated with lifestyle because there's no specific medications that are consistent from person to person to person that helps with IBS symptoms. Yeah, if somebody's having a flare of diarrhea and with IBS, they could try some Imodium, but it's more of a long-term care management plan where there's journaling that I always suggest patients do that have IBS, because we need to know what is their type of IBS, I guess you could say. They don't necessarily, I don't want to mislead anybody by that, but I'm just saying type because there is variation in how people express their symptoms or their irritable bowel syndrome. And so I try to get everything that we could as far as timing of food, timing of symptoms, how many times did they have diarrhea that day, or what's their bowel schedule like. And so you start getting all this information first, and then you can start kind of dissecting where you go as far as treatment plans and things like that. And you start looking for triggers and flares, because there's certain food triggers, there's certain emotional and kind of lifestyle triggers, like how does it correlate with even people's exercise routines. And so that all becomes important. And I always tell my patients, because abdominal pain's a crapshoot, no pun intended. Yeah, kind of funny. Anyway, abdominal pain can be challenging. I always tell my patients that it's often easier to diagnose the emergent abdominal pains, or at least in a way, because it's like we can do a test for appendicitis, we can do imaging for that, we can do imaging for gallbladder issues, we can do other imagings and have chemical markers for something like pancreatitis and all these other types of things that are a little bit more serious and concerning. But stuff that is, I should say, less life-threatening, that's inconsistent, can be so challenging to nail down. And hopefully that kind of gives you an idea. It's one of those things that's just each person really needs to get as much information about their condition as they possibly can. I always suggest they do that before they go to GI. So I'm assuming this is a serious question, so I'm going to answer it. Mr. Wolf a lot, can a burp turn into a fart? The answer is no. No, there's no way. It's like both burps are essentially from the stomach up for the most part. To get a burp to move 20 feet through the small bowel, you're going to have to go through the pyloric sphincter, all through the coils of the small intestine. Then you're going to have to go through the ileocecal valve, and then you're going to have to move through fecal. No, yeah, it's just not. So we're going to say those are separate issues. Okay. I like how this is worded. Oh, I love how this is worded. So we're going to go with this, you guys. So really fun. Sorry, I'll set it down. Is the digestive acid stored somewhere or is it made to order? I wish it was. Yeah, it's more made to order. The digestive acid, it's kind of a comparison to the bile. For example, liver produces bile, but the gallbladder stores it. And we don't have like a storage facility for acid. So in essence, if I had to pick between those, it's more made to order. Now you're constantly producing some level of acid, but some things will stimulate more acid production, like certain foods when you eat. But yeah, more made to order. I love how that was worded. So tell us about the nerve, like criminal nerve of Grassy. So tell us about the nerve supply like the stomach and the criminal nerve of Grassy. So the nerve supply to the stomach, we teach it as the vagus nerve. And the vagus nerve is a cranial nerve, and vagus is not referring to Las Vegas. It's referring to, it's spelled differently, and it means the wanderer. So because it's wandering and essentially following the lining of the gut tube. And so the vagus nerve has kind of this nerve supply and is in charge of getting things moving with the stomach. And that's a pretty intense topic. And I think we should probably do a full video of that. If you had like a specific question about, say, like the vagus nerve or the criminal nerve of Grassy, I guess that's kind of broad for me to go over all that. But it is one interesting factoid. The gut tube or the digestive tract has its own nervous system called the enteric nervous system, which is pretty amazing. It's this kind of what we believe to be this leftover nervous system for the primitive gut before we developed higher functions and higher nervous system control. And the vagus nerve is, I guess you could say, not part of that enteric nervous system. The parasympathetic nervous system is essentially going to be working partly through this vagus nerve. We nickname the parasympathetic nervous system the rest and digest system, and that controls the smooth muscle of the gut tube to help propel and send signals to the smooth muscle of the gut tube to make it contract and move food along there. Thanks for your content. Can you explain gastritis? Yes. So let's pull this comment on there. So can you explain gastritis? Kate LM 423. If we break down the term, gastro just means stomach, itis means inflammation, and gastritis is kind of the irritation of the inside lining of the stomach, and there's multiple causes. You could get it from certain drugs like aspirin, NSAIDs, other medications that can irritate the inside lining of the stomach or suppress the amount of mucus that's produced in the stomach. You can get it from alcohol, like too much alcohol can cause it. There is a bacteria even called H. pylori, and H. pylori is a bacteria that has been linked to gastritis and even ulcers, kind of changing the pH of the stomach. Oftentimes we will, in one of my clinics, we would test for that when people were kind of showing symptoms of gastritis or epigastric pain or pain around where the stomach is. And so obviously you need to know what the underlying cause of that is, and that's where we kind of go for treatment. And a lot of times people with GERD, which is heartburn and gastroesophageal reflux disease, can also have gastritis with it as well. Okay. So I have to bring this up here, partly because of what's coming. Is it Hajera Jamal Sharif? Kindly tell me, what does it pain during menstruation freaking? Do you have a solution for the pain? Okay, so I think I get what the idea is. It's asking about menstrual cramps, and you might be a little mad at me because I'm going to not answer this question fully yet, because we have a video dropping in 2 or 3 days on this topic on YouTube where we talk about the whole female reproductive cycle. We're going to do it into 4 different episodes. But the first episode is on menstrual cramps. So we're going to talk about essentially the pain that causes it. Now, I'll give you a little teaser. Most of the pain is from the smooth muscle inside the uterus cramping, and well, it's contracting, which causes the cramping pain. And that can refer different places in women depending on kind of their uterus, and pain is a little bit subjective from person to person, so it can change, but sometimes it radiates to the back. And I obviously do not have a uterus, so I can't really give the exact feeling of what this would be like, but I can tell you the anatomy and physiology of this. But we're going to talk about treatments too. But essentially, some of the treatments are involved in inhibiting those smooth muscle contractions a little bit. So that's coming soon. So just keep an eye on that for us, or when we post that video. So, let's see, what do we got here? Bear. One of the most interesting and educational channels I've seen, and I enjoy watching so much. Thank you for sharing your time and knowledge with us. Bear, there wasn't a question in there, but absolutely, you're welcome. Thanks for watching and supporting us. Okay. Goodness. So, ladies and gentlemen, we have been at this for an hour. I'm going to answer one more question here. Okay, this is from Ariane Pratt. Why doesn't acid hurt the stomach? I think I already answered this, though, so I'm not sure if you missed this or if you came on late, but we'll just explain it one quick last time, because we have the stomach lining, mucus on top of that, and then the acid, essentially. So the thick coating of mucus stops the stomach from eating itself alive, in a way. So, great question, though. Okay. Ladies and gentlemen, I am going to go all the way to the bottom and go a little bit backwards, just because we have so many comments coming through. So, this has popped up, Sahab Moapartra. Let's see. Pyloric antrums. So, we're going to have to get to that question in our next live. I won't forget you on this one, just because that's going to be a more in-depth and involved answer to that question. But we're going to do one more question here. Just finding one here. Okay, these are mostly nice, just comments here. So, I'll just answer this one. What about endometriosis? Why is there no cure? So, I guess that depends on who you talk to about the cure on this. So, the purists would say a surgical procedure maybe isn't a cure, kind of just a fix there. One of the procedures that they do is sometimes people will do a hysterectomy, and that isn't always necessarily the best situation, but you have to kind of understand what endometriosis is first, and there's debates on this too. Justin did a YouTube video, so Butterfly Blessing, I would check out Justin's endometriosis video on our channel. But endometriosis is endometrial tissue or endometrial cells found outside of the uterus. Now, some people have different theories on how it got there. Was it retrograde? Did it move backwards into the uterine tubes, into the abdominal cavity? There's other theories to this, and some people get pretty upset about it, actually, because we've had debates with people about where the origin of endometriosis comes through, and that's not the point of this answer that I'm going to do. But I do want you to check out the actual YouTube video, and essentially one of the treatments is they will go in and remove the uterus. Or I was involved in one surgery where they went through the abdominal cavity with the scope, or laparoscopy. Wow, I couldn't say that word. The laparoscope, and they went in and we literally were zapping, for lack of a better word, endometrial lesions that were on the inside of the abdominal cavity, and so that was a surgical procedure. So you guys, I appreciate all your guys' time. That's an hour. I will talk about BPPV in a later video. This is, if I was a little bit late, I apologize, you guys. Literally, the internet went down right before I set everything up, and it was super frustrating, but I'm glad we got this done. Post some more questions on our feed. We'll try to cover everything we can. It's overwhelmingly awesome, I guess, if that makes sense, all the support and the questions we get. And so I apologize if I don't answer all your questions. You can hit us up on Instagram, TikTok, and that might give you a chance to get an answer, or at least make it more aware, because these are just coming through like super fast. And so sometimes I miss them and I apologize. And so if you post also on our YouTube posts, I do that for a reason, because I put a post in, and if we get a lot of questions on there, I can get those answered kind of at the beginning of the feed. So anyway, you guys, I appreciate everything. Thanks for coming and watching. I will see you guys next week, because we're going to do these every week, and we'll see you later.